Next, we're going to calibration and maintenance, 21 CFR 211.68. Equipment, mechanical, automated, electronic must be calibrated, inspected, or checked, being written program. So in every firm, you have a calibration/maintenance department who will make sure all your equipment is calibrated and maintained, because if you have equipment that's out of whack, ultimately you're not going to be able to produce a quality material. So ensuring that everything is calibrated, maintained, and that you're following a good preventive maintenance program helps ensure that your equipment will be able to run at its highest level and be able to produce a quality product on a consistent basis. So calibration and maintenance is key in ensuring, and that will happen because ultimately, if your equipment is not working right, it's not going to produce a high quality material. So FDA's 2011 process validation guidance defines it as the collection and evaluation of data from the process design stage through commercial production, which establishes scientific evidence that a process is capable of consistently delivering product quality. So what we went through from the CFR ultimately helps you get to a point where you're consistently going to be able to design a program where you can go to commercial production and consistently deliver a quality product if you follow the guidelines step by step. So that's what the CFR helps you and your firm do, because you want to make sure that's in place before you go into commercial production. Because if not, you will not have the documented evidence being to prove to the FDA that you're in a state of control. And if you're not in a state of control, the FDA will quickly write you up, and ultimately you can be out of business because you're not able to produce the data to prove that. So it's important to be able to prove that, to be able to manufacture and provide that scientific evidence that your process is in control and you can consistently produce at a high level. So that's ultimately the purpose of validation. So when you're working validation, you'll deal with product lifecycle concept. So you go into the design phase, then you go into production, distribution, and then over time, your equipment will, when any piece of equipment, such as your car or anything, it will go bad. So you have to more likely replace it. So you have to decommission that item and then go through the whole validation process again to bring in another equipment on site. So definition aligns process validation activities with the product lifecycle concept, and scientific evidence replaces high degree of assurance. So again, ultimately, you just want to have that scientific evidence to give the assurance. And this product lifecycle drives validation and kind of helps us guide us into how we want to validate based on our design and then we want to produce and distribute. Next, we're going to the activities needed to validate. So we're going to design and develop, conducting clinical trials, manufacturing, packaging, labeling, storage, distribution, and installing service. So in summary, CGMP, which stands for Current Good Manufacturing Practices, there are regulations requiring that manufacturing processes be designed and controlled to ensure that end process materials and the finished product meet predetermined quality requirements and do so consistently and reliably. So again, that's what I've slides we went through. It just ensures that we have a high quality product and we can make this material consistently and reliably. That's the concept of validation. And as we said, when we went over, validation requires 1, documented evidence. If it did not happen, if you didn't write it down, it didn't happen. it requires a high degree of assurance. So you need that scientific evidence that your acceptance criteria, you've met it and that is documented. And then ultimately, you want to be consistently produce. So validation ultimately proves that you can consistently produce at a high level from batch to batch. That's what validation is all about. So I want you guys to think about it. Can you think of any documents in your organization that will support documented evidence in the validation of manufacturing of a product? So you guys can think about that. Think of any documents in your organization that will support documented evidence. And maybe I'll set up a blog where you guys can go in and put in your thoughts about this. But it's just something that I want you guys to think about. And then we'll maybe have a blog or a place where you can go and input your ideas on any documents in your organization that will support documented evidence in the validation and manufacture of the product. So give that some thought. And I will answer you as you guys come up with those thoughts. And knowledge check. Another thing to think about. Which of the following define validation? Is it documented evidence? Is it a consistent process? Is it a high degree of assurance? Is it all of the above? I'm not going to give you the answer. I want you guys to think about it, go through the slides. More than likely, this question will be at one of the questions in our quiz. But it's just something I want you guys to think about, and you'll be able to answer that in our quiz. Next, we'll go into the concept or go into the product lifecycle concept. So when you've completed this part, you'll be able to explain what is meant by product lifecycle, and then you'll also be able to describe the phase of a drug product lifecycle. So there are 4 stages of the product lifecycle. You have your introduction, you have your growth, you have your maturity, and then decline. And we'll go into more detail on each stage of the product lifecycle. So from a financial perspective, you want to process a product that goes through from when it's first introduced into the market until it declines or removed from the market. So this kind of just says when you have a product like a drug, you introduce it, and initially when you introduce it, there's high growth because then there's great demand, especially if it's a good quality product and people want to have it. Then it matures, it kind of levels off, and then you have a decline because if you're familiar with any drug product, if a company introduces that drug, they have exclusive rights to it for a certain amount of years. And then after those years are up, then generic companies can come in and make the product for significantly cheaper because one, they didn't have to pour all the money into R&D and to try to put this product out. They just simply copied what that other company did and were able to manufacture it. And because their cost was substantially lower, they're not looking to make a huge profit. So they can come in and sell it for cheaper. So that kind of declines the growth from the original company. So that's kind of the life cycle of the product. So as you're building a product, so one of your goals is to build demand for the product. You build demand by doing something that's unique, doing something that's high quality, doing something that people just need, and being able to ultimately market it, promote it. As you're going through it, your spending is high, and as we all know, with any product or any business, there's no guarantees. You can make a product and spend all this money in it, market it, and it gets to the market, and the doctors that prescribe it, they don't believe in it, the patients don't believe in it, and ultimately there's no guarantee that your product will develop. So ultimately it's a miss. But if you hopefully do it right and you get to the stage, hopefully more likely you can produce a high quality product that's going to do well in the market, but it's not always the case. That's part of the introduction life cycle. Once it passes introduction, the product is growing, you have this growth phase, where the concept is proven and sales are increasing. So that's a growth concept. You maximize your profit year. This is time where the companies really want to make the earnings of the product and get all the money they spend in R&D and clinical trials to that and make profit. So that's that growth phase. And then you go into maturity where saturation is reached, sales volume is maxed out, and innovations are maintained or increase market share is slim to none. So an example is the iPod versus the iPhone. So initially the iPod was a hot commodity. When it was rolled out, it was high growth, high demand. But the minute the iPhone came out, the iPod started to decline because everything you can do in the iPod, you can do in your iPhone, plus be able to talk text. So what's the point of carrying two devices when my iPhone can do everything and so? So that's kind of what led to the decline of the iPod when the iPhone came out. And then lastly, we have the decline phase. So sales drops significantly, there's less demand, loss of market share due to competition. So like I said earlier, your general product comes into the market. And your sales drop because something is cheaper, same quality, because the consumer want money to do. Consumer want to spend less money for a quality product. So that expensive product that was on the market exclusively, it declines as the general and generic manufacturers come in and are able to give you a quality product for significantly cheaper.